Thank you very much, Facility. I'm delighted to be part of this masterclass empowering members for continuous patient support and as I say, very delighted to be able to share with you our own experience in patient involvement in the research agenda. So as Facility has said, I'm a cancer biologist. I work in the UCD Conway Institute in University College Dublin, Ireland. I'm a cancer biologist, specifically working in breast cancer, but another part of my work, which I'm very passionate about, is the patient voice in cancer research, looking at the journey of patient involvement and really actively involving patients within the cancer research agenda. Now, to put this in focus, we know that the Horizon Europe funding has 5 missions, one of which is in the area of cancer. And this mission specifically is that by 2030, more than 3 million lives will be saved, living longer and better. It already demonstrates how citizen and patient-centric aspects of this call will be, and there's a big emphasis on societal impact. So there will be a very close scrutiny of, involvement of patients within this process. We also know from another funding agency, Cancer Grand Challenges, this was a very substantial CRUK NCI co-funded call, which ended in April. The call closed in April. This is where they identified 9 key pillars or areas where cancer research really needs to be given support financially. And what was lovely about this was that these 9 challenges were actually established through consultation with the global research community and people affected by cancer. So this was really very, very powerful, that patients were feeding into areas that really deserved further cancer research funding. We also know, of course, that patients are now reviewing our grant applications and are contributing towards the assessment criteria. So where did we start in relation to the patient voice in cancer research? Well, as Basilica said, this started quite a number of years ago in 2016. This is the UCD Conway Institute. It has about 400 PhD students and PIs associated with the institute, and many of these are involved with cancer research. We were always very keen that we wanted to have the doors open for cancer survivors, partners, family members to come in and look at the research facilities, but importantly, to have discussions with our research community. And the feedback from these laboratory tours was absolutely brilliant. Patients were thrilled to see all the research that was going on. When they were engaging with our researchers, they couldn't believe that in some cases the research was actually on their specific type of tumour. From the researcher's perspective, there might have been a slight bit of trepidation. What if we say something slightly negative or worrying about a poor prognosis tumour? But none of this really needs to be worried about. Patients are exceptionally informed about their cancer. And this two-way dialogue that happened between our visitors and our researchers, we really felt we wanted to harness that and to continue with it and really embrace it, for want of a better word. So our very first workshop was in April 2016. We had sent out questions to our patients in relation to key issues around patient information, patient research, what would they be interested in hearing about in relation to clinical trials, what aspects of cancer research would they like to hear more about. This is a sort of a similar setup for each of our workshops, where we have round tables, where we have patients and researchers working together. Each table is facilitated and we have a scriber with flip charts, and all of this information then is brought together at the end of the workshop and fed back to the participants. So from that particular workshop, this is just an executive summary, but there were some key recommendations under the headings of patient information, clinical trials, patient involvement in research, and patient supports. And 2 that I just wanted to highlight for you were that patients would be happy to participate in research and to develop research strategies. And within patient supports, clinicians should focus on quality of life and coping strategies for living with cancer, as well as treatment, very reminiscent of the Horizon sort of ethos that I mentioned at the very beginning. Following this, we went back out, just to say here that this was feedback that we got from that initial event. The support group with which I'm involved would be very happy to be part of research. We should try and get a research cancer into the treatment mode. I felt I should participate in research because others did it for me years ago. So very positive feedback. Lovely to see this conversation happening naturally between researchers and patients. So we then went back out into the community that had attended that initial workshop, and we asked, would any of our patients be interested in being more formally involved by the establishment of the Patient Voice in Cancer Research Committee? And once we had that committee together, we worked with patients on our mission statement, which is that the patient voice in cancer research is an initiative to actively engage cancer patients, cancer researchers, and other interested parties in discussions and decision-making processes which positively impact on cancer research, cancer treatment, and outcomes for patients. A key factor in this dialogue is mutual trust, respect, and understanding between the patient and the researcher. So once we had our terms of reference and our governance piece in place and our mission statement, we started working through quite a number of workshops. Usually we have 2 per year. And the one that I'd like to specifically share with you is one that took place in February 2020. This was 2 weeks before COVID-19 locked down the country. And this was a fantastic collaborative event that we had with the National Cancer Research Institute UK. It was a Dragon's Den event involving patients and carers in cancer research. And as I say, it really was a very worthwhile workshop that we had. So this was held in February 2020. We had it the day before our annual Association for Cancer Research meeting. So our annual cancer conference attracts about 400 cancer researchers across the island of Ireland. And we thought that this would be a very good opportunity that we would have our patient voice in cancer research workshop before this annual cancer research conference. We put a call out to the researchers who were attending that conference, asking them would they like to have the possibility of being part of a Dragon's Den, where they could have a conversation with patients around particular issues in relation to a hypothesis, a lay abstract, a PPI section, a medical device, something like that. So we had 10 cancer research groups from around the country that took part in this. And as we know, instead of looking for investment, these researchers were looking for advice and feedback from people with a lived experience of cancer, either as a patient, family member, carer, or patient advocate. So this gives you an idea of some of the research questions that our researchers wanted to have some input from the expert of experience. So on table 4, this is a medical device, Immunocell, which looks at the targeted delivery of natural killer cells to improve outcomes in ovarian cancer. And table 7, our researchers were interested in getting feedback again on another medical device for the management of chemotherapy-induced pancytopenia. And we know that this is relevant for so many cancer presentations. So once the research themes were identified, we sent out the table information and any supporting documentation to our PVCR network. We asked patients to see if they would like to become part of the Dragon's Den event and to pick a table where they feel they really would like to contribute. And so once we had sort of brought together the Dragon's Den or our experts with experience at tables that they were interested in with researchers, these tables were established. So in a 2-hour workshop, each researcher had the amazing opportunity to have a discussion with the Dragon's Dens. Again, this was facilitated and then scribed. This is the absolute brainchild here of Richard Stevens, Consumer Forum in the National Cancer Research Institute. Stephen had led on many of these Dragon's Den events in the UK, but this was the first time that we'd had one in Ireland. So as I say, it was exceptionally successful. And when we look at the feedback from the attendees, our patients said, it felt very empowering to be part of the research discussion and have a voice. Progressive, informative, and providing patients with a chance to participate in the future of cancer research. And this is just some of the feedback we got. From the feedback in relation to the researchers and how they found the event, this was my first time getting my first time getting patient feedback on the device and proved extremely useful. I always thought I was thinking about the patient's perspective, but doing Dragon's Den, I found out what the patient perspective actually was. An aspect of PVCR that is very important are our training workshops. This is Miss Elaine Quinn, who has worked very closely with me since 2016 on the patient voice in cancer research. And she has led on workshops helping young investigators to write a lay abstract. We know how incredibly important this is in our grant applications. How do we, impact PPI into our grant applications? We know that these are substantial sections now of our grant applications. And how do we communicate our research to the general public? And what's key in all of these workshops is that patients are working alongside researchers throughout the entire process. So there's no recipe, there's no blueprint. This has been one of the most rewarding aspects of my cancer biology career. Working in patient voice and cancer research, it is constantly revolving and, as I say, an incredibly rewarding process. On behalf of the PVCR committee, I would like to thank all of our patients and family members and carers who regularly attend our events and are giving such support and insight for our researchers that really are so very grateful for this. And I'd like to finish with a quotation from one of our patients who is on the PVCR committee. I get great satisfaction from contributing to something that I feel is adding to improvement in either the public perception of cancer treatment or science. So with that, I'd like to thank you very much again for the invitation. Delighted to be here, and I hope that there may be some elements of that might have been of interest. So thank you very much.